I work at Moffitt Cancer Center, which is a NCI, NCCN designated cancer center. And I became a surgical oncologist because early on in general surgery, I was interested in operating on the patients with cancer more so than the other subspecialties of general surgery. I've been at Moffitt for 20 years. We've always had an interest at Moffitt in leading the way with the studies in GEP and these patients with melanoma to help prognosticate, stratify for clinical trials, understand recurrence risk, and in particular with the Merlin 001 study, some of the most important challenges when treating patients with melanoma are the ones who really don't have the conventional, easy, wide excision sentinel lymph node, where there's a lot of decision making that has to be made. There are tumor related factors, patient related factors. And I think the trial marks a milestone in our ability to really personalize melanoma management by integrating gene expression profiling testing with clinical decision making. It helps us identify truly who's low risk for lymph node metastases. And the Merlin assay really allows us as clinicians to make more informed, evidence-based choices, potentially sparing some patients an unnecessary procedure and the general anesthesia that goes along with it. Older patients, we see the biggest benefit of the test. And it really allows us to get a percentage, not just low risk and high risk, but a percentage that of sentinel lymph node positivity based on a robust prospective clinical trial, which is the highest level of evidence, and then use that percentage to talk to the patient and have a realistic conversation of what their prognosis is and what their potential sentinel lymph node positivity rate is. And that allows us to make those informed and shared decisions with the patient.